So for most of our field, people didn't even know what was happening. Some of the people started asking, there's taxes that are coming up, do you have information on that? And that's why we started flagging it from our field, and then we said, okay, we need to reach out to NILC. Deferred Action for Childhood Arrivals is a program that was won by undocumented immigrant youth back in 2012 after pressuring President Obama to provide some relief for immigrant youth. We were able to win the campaign, and it actually provided immigrant youth with a 2-year work permit as well as no deportation. When I was undocumented for 21 years here in the US, and as I started working, I would pay my taxes. That was just part of what you're supposed to do. And so even now with people getting deferred action, that's still very important for them. And then as ACA also started, they started asking us, so there's this penalty that people are telling me in certain places that I'm supposed to pay for this penalty because I have DACA, but I don't have, I'm not eligible for ACA, and so what does that mean, or how does that make sense to me? And so we partner, of course, with the National Immigration Law Center, because not only are they amazing, but they just have really helped us figure out what does that mean with ACA. They're very knowledgeable about ACA and also about taxes.
We looked at what the issuers and what the tax filing companies were putting out, the information that they had available for consumers, and none of it had any information about DACA and DACA being exempted from the tax penalty. So we looked at the IRS website and healthcare.gov's website, and that also did not have any information about DACA and how they were exempt from the individual mandate and from the tax penalty. Under the Affordable Care Act, if you do not have insurance and you don't qualify for one of these exemptions, then you have to pay a penalty. But then that tax penalty starts off small and it ramps up over a couple of years. So it really does balloon to a pretty significant amount of money. So for low-income families, if you get hit with a penalty, it can be a sizable hit. The immediate reaction was to clarify to people who would come to us, like, look, if you have DACA, you're exempt from the individual mandate and you should not pay the penalty. We then brought it to the attention of all the sort of players, right? So IRS, to Department of Health and Human Services, to some of the big tax filing groups, to sort of clarify that, you know, look, these are the regs, it's very clear they're exempt, and you need to get that information across to the consumer and to the people who are on the ground who are helping these people file their taxes.
The National Immigration Law Center does a huge difference in people's lives, I think. We're not lawyers, and so it just kind of helps that partnership of like break it down so that I make sure that all the information that you know can be easily available from our leaders, and not only our leaders but also just the community overall.
Because at the very least, people who aren't eligible for affordable health care aren't going to have to then pay a penalty for not having insurance. All immigrants, regardless of status, should have affordable health care. But this group, DACA, because they are here, they're authorized to live and to work, and they're part of our community, and we want to integrate them into our community. It doesn't make sense to exclude them from affordable health care.
I would say they're also a force to reckon with. You know that if NILC is on your side, they're gonna fight all the way until the end to get you that win that you need. They care about the community, they care about the family, and when you work with them, you feel like family.